What if I told you that the biological process that can eventually lead to stomach cancer can begin with a bacterial infection acquired years, sometimes even decades earlier? You could be carrying this infection in your stomach right now without knowing it. No pain, no vomiting, no obvious warning signs. The bacterium is called Helicobacter pylori or H. pylori. Its connection with stomach cancer is not speculation. H. pylori is recognized as a proven human carcinogen. But before you become frightened, understand this clearly. Most people who have H. pylori will never develop stomach cancer. Having this infection does not mean you have cancer, and it does not mean cancer is inevitable. And that distinction truly matters. The reason H. pylori matters is simple. It is a treatable infection, and eliminating it can remove an important risk factor before more serious changes develop. So stay with me, because I will explain who should be tested, which tests are reliable, and why feeling better after treatment does not prove that the infection has disappeared. I am Dr. Rajesh Kumar, and this is something every Indian family should understand. So how can such a tiny bacterium survive in a stomach filled with powerful acid? H. pylori has a clever survival mechanism. It produces an enzyme called urease, which helps create a less acidic environment around the bacterium. This allows it to survive close to the stomach lining. Once H. pylori establishes an infection, it can remain there for many years unless it is specifically treated. Some people develop chronic gastritis, some develop gastric or duodenal ulcers. Others experience abdominal discomfort, nausea, indigestion, or burning. Yet many people feel completely normal. That is why symptoms alone cannot diagnose H. pylori. Gas, bloating, or acidity does not automatically mean you have this infection. At the same time, having no symptoms does not prove that you are free from it. Now let's come to the cancer connection. Persistent H. pylori infection can cause long-standing inflammation in the stomach lining. Over time, in susceptible people, this inflammation can damage normal stomach glands and lead to atrophic gastritis. The cells can then undergo further changes, including intestinal metaplasia, followed in a smaller group by dysplasia and eventually gastric cancer. But remember this carefully. Most people with H. pylori do not go through this entire sequence. H. pylori increases your risk. It does not determine your destiny. The connection between H. pylori and stomach cancer is supported by strong scientific evidence. But there is another condition that shows how important this infection can be. H. pylori is also strongly linked with a less common cancer called gastric MALT lymphoma, a type of lymphoma that develops in the stomach. In selected patients with early stage H. pylori positive gastric MALT lymphoma, eliminating the infection alone can lead to regression of the lymphoma. That tells us how powerful the biological effect of this bacterium can be inside the stomach. So why should we discuss H. pylori in India? Because this infection is common in our country and many people acquire it early in life. Once established, it can remain in the stomach for years if it is not treated. But this does not mean every Indian needs an endoscopy. And it certainly does not mean that every person with acidity, gas, or indigestion should start antibiotics. That would be a serious mistake. Antibiotic resistance is making H. pylori more difficult to eliminate in many parts of the world. Using antibiotics unnecessarily, taking an old prescription, stopping treatment before completing the prescribed course, or copying medicines given to a friend or relative can reduce treatment success and contribute to antibiotic resistance. So if your neighbor was treated for H. pylori, do not simply take the same medicines. And if you repeatedly experience acidity, do not keep treating yourself with antibiotics. The correct approach is simple. Test the right person, use the right test, and treat a confirmed infection appropriately. How do we test for H. pylori? One of the most useful non-invasive options is the urea breath test. Another reliable option for active infection is the stool antigen test. If you are undergoing an upper gastrointestinal endoscopy for an appropriate medical reason, your gastroenterologist can also take biopsies from the stomach lining and test them for H. pylori. Remember, symptoms alone cannot tell you whether the infection is present. The purpose of testing is to identify active H. pylori accurately before exposing you to an unnecessary antibiotic course. There is one test that often causes confusion: the H. pylori IgG blood antibody test. A positive antibody result does not always prove that you currently have an active infection. Antibodies can remain detectable even after H. pylori has been eliminated. This is why blood antibody testing is not the right test for confirming whether treatment has worked. Timing also matters. Proton pump inhibitors, or PPIs, which are commonly used for acidity and reflux, can reduce the accuracy of some H. pylori tests. Recent antibiotics and bismuth-containing medicines can also interfere with the result and produce a false negative. So do not walk into a diagnostic center and randomly choose an H. pylori test from a list. Speak to your doctor or gastroenterologist, explain your symptoms and medicines, and use the appropriate test at the appropriate time. The next question is equally important. If H. pylori is confirmed, how should it be treated properly? Now let's say your test confirms H. pylori. Can it be treated successfully? In most people, yes, but the treatment has to be chosen properly. H. pylori eradication usually requires strong acid suppression together with a combination of antibiotics and sometimes bismuth. The exact regimen depends on factors such as previous antibiotic exposure, local resistance patterns, allergies, and the treatment guidelines your doctor follows. This is important because H. pylori treatment has changed over time. A prescription that worked for someone 5 or 10 years ago is not automatically the right prescription for you today. Resistance to commonly used antibiotics has increased, and some older treatment combinations are now less reliable in many settings. That is why you should never copy an old prescription from a relative, neighbor, or friend. Take the medicines exactly as prescribed and complete the full course. Stopping early because your pain has improved can reduce the chance of successful eradication. And here is another mistake I see repeatedly. A patient finishes treatment, the burning settles, the stomach feels better, the person assumes the bacteria must be gone. Not necessarily. Feeling better does not prove that H. pylori has been eliminated. Your symptoms can improve even when the infection remains. This is why confirming eradication after treatment is so important. Modern guidelines recommend a test of cure after H. pylori treatment. This is usually done with a urea breath test or stool antigen test at the appropriate time after therapy. Testing too early or while taking certain acid-suppressing medicines can give an inaccurate result. Your doctor will advise you when to test and whether any medicines need to be stopped temporarily beforehand. Test of cure is generally performed at least 4 weeks after antibiotics and bismuth have been completed. Proton pump inhibitors are usually withheld for about 2 weeks before testing when clinically appropriate, because they can suppress the bacteria and increase the chance of a false negative result. If you find explanations like this useful, subscribe to the channel. My aim is to help you understand your health clearly without panic and without unnecessary treatment. Now we come to the question that matters most in this video. If H. pylori can contribute to stomach cancer, does eliminating the infection actually reduce your future cancer risk? Yes. Clinical trials and systematic reviews show that successful H. pylori eradication reduces the future incidence of gastric cancer in infected people. This is why treatment is not only about relieving gastritis or healing an ulcer. For a person with confirmed H. pylori infection, successful eradication is also an important cancer prevention strategy. The preventive benefit is greatest when H. pylori is identified and eliminated before advanced precancerous changes develop in the stomach lining. But what if those changes are already present? What if an endoscopy has shown gastric atrophy or intestinal metaplasia? That is where the next part becomes especially important, because eliminating the bacterium is still necessary, but the future cancer risk does not automatically return completely to zero. If an endoscopy has already shown gastric atrophy or intestinal metaplasia, H. pylori eradication is still important. But you need to understand one crucial point. Removing the bacterium does not automatically erase every change that has already developed in the stomach lining. Atrophic gastritis means that some of the normal glands of the stomach have been damaged or lost after long-standing inflammation. Intestinal metaplasia means that some stomach cells have changed into a type that resembles cells normally found in the intestine. These are considered precancerous changes. They're not stomach cancer, but they tell us that the stomach has already traveled further along the pathway that can lead to cancer. This is why simply saying I finished my H. pylori treatment, so everything is normal now, is not always correct. Some people with extensive or higher risk precancerous changes need closer follow-up. Depending on the extent and type of these changes, biopsy findings, family history, and other risk factors, your gastroenterologist may recommend periodic upper gastrointestinal endoscopy. The purpose is not to frighten you. It is to identify important changes early when they are easier to manage. The follow-up plan should be based on your individual risk. And there is one group I want to speak to especially. If your mother, father, brother, sister, or child has had stomach cancer, tell your doctor. A first-degree family history of gastric cancer is an important risk factor and can change how your own risk is assessed. Do not assume that repeated indigestion is harmless simply because you have lived with it for years. If this information is useful, comment H. pylori below. It helps me know which health topics you want me to explain clearly in future videos. Now let us talk about symptoms that should not simply be dismissed as gas, acidity, or aging. Unexplained weight loss deserves attention, persistent vomiting deserves attention, vomiting blood, passing black or tarry stools, or having evidence of iron deficiency, anemia needs proper medical assessment. Difficulty swallowing is another warning sign. So, is a persistent loss of appetite or repeatedly feeling full after eating only a small amount of food. These symptoms do not automatically mean you have stomach cancer. There are many other possible causes. But the right response is not to continue taking acidity medicines for months without finding out why the symptoms are persisting. This becomes even more important as you grow older because the risk of stomach cancer increases with age. Whether you need an endoscopy depends on the full picture. Your symptoms, previous findings, family history, H. pylori status, medicines, and other risk factors. Your gastroenterologist can decide when an upper gastrointestinal endoscopy is appropriate and whether biopsies are needed. So remember the principle. Eliminate H. pylori when it is confirmed, but do not stop thinking about risk once treatment is completed. For some people, the infection is only one part of the story. And in the final part, I will bring everything together into 5 simple points you can remember. Let me leave you with 5 things I want you to remember from this video. Number 1, H. pylori is common, and many people who carry it have no symptoms. You can feel well and still have the infection. That is why symptoms alone cannot tell you whether H. pylori is present. Number 2, most people with H. pylori will never develop stomach cancer. So do not panic if your test is positive. Persistent H. pylori infection is an established risk factor for gastric cancer, and a confirmed infection should be treated properly. Number 3, do not self-medicate. Do not take antibiotics simply because you have acidity, gas, or indigestion. Do not copy an old prescription from a friend or relative. Test appropriately, use the correct treatment, and complete the full course as prescribed. Number 4, feeling better after treatment does not prove that H. pylori has disappeared. You still need a proper test of cure. Your doctor may recommend a urea breath test or stool antigen test and will advise you about medicines that need to be stopped temporarily before testing. Number 5, if you already have gastric atrophy, intestinal metaplasia, or a first-degree family history of stomach cancer, eliminating H. pylori does not automatically return your future risk to zero. You may need further assessment or follow-up based on your individual risk. And if warning symptoms such as unexplained weight loss, persistent vomiting, black stools, difficulty swallowing, or ongoing loss of appetite continue, they should be properly investigated. So the message today is not to be frightened of H. pylori. It is to understand it. Do not ignore a confirmed infection. Do not keep treating repeated acidity without finding the cause, and do not take unnecessary antibiotics. Stomach cancer does not usually appear overnight. In some people, the biological process develops slowly over many years. Age. Pylori gives us something valuable, an opportunity to identify an important risk factor and act before more serious changes develop. You do not need fear. You need the right test, the right treatment, and proper confirmation that the infection has been eradicated. If this video helped you understand H. pylori clearly, give this video a like. Please share it with a family member or friend who keeps struggling with repeated acidity, indigestion, or stomach problems. The right information at the right time can help someone make a better decision about their health.